Essentially, despite the very comprehensive list that I'm going to read to you, blepharoplasty is a fairly safe and effective procedure when considered with many more invasive plastic surgery procedures. And it's true to say that the vast majority of patients who undergo cosmetic lid surgery are pleased with their results. That's certainly my 25-year experience. But complications are significant in this area, and when they do occur, they're annoying, that is for sure, if not more. So here goes. Infection can occur. Bleeding can occur, requiring a return to theatre or evacuation of clot. Wound separation can occur. If the wound splits open a little bit, it will usually heal, but it may need restitching. Cysts along the stitch line, called milia, little whiteheads or lumps that form in the stitch line of an upper or lower lid blepharoplasty, are quite common and easily fixed. Asymmetry, so eyelids that look good individually may not match as a pair, and there's always some underlying asymmetry there, but asymmetry that's increased by the surgery is a complication of surgery. Hopefully it won't happen, but very occasionally it will. Insufficient skin removal, excessive skin removal, insufficient fat removal, excessive fat removal, excessive muscle removal. Aggressive removal of the orbicularis muscle from the upper lid may hollow the eye and create a weaker eyelid closure. Excessive internal scarring or fibrosis or shrinkage of the internal eyelid layers called the middle lamella of the lower lid may cause distortion or retraction of the lower lid. Excessive visible external scarring, inappropriately positioned crease, rounding of the lateral edge of the eye, drooping of the upper lid. Blepharoplasty can sometimes unveil a pre-existing ptosis or droop. Fat necrosis, which I've never personally seen, but technically would be possible to occur. Swelling on the surface of the eyelid, of the eyeball, called chemosis, or post-surgery edema. It's been reported in up to 10% of patients having lower lid blepharoplasty. Nearly all cases just spontaneously resolve. Injury to the lacrimal drainage system or tear ducts of the eye. Permanent double vision. If the muscles that move the eyeball are injured or scarring occurs in the fat around the eye, then some degree of double vision can occur. I've seen this on one occasion. Difficulty in closing the eyes. Skin discoloration of the upper lid particularly, which can look redder, even permanently after upper lid surgery. The need for follow-up surgery, temporarily blurred vision, loss of vision. So catastrophic loss of vision has been reported in lid surgery and known to occur in less than 1 in 10,000 cases. I've never seen it in 25 years. It's thought to be associated if there's a bleed behind the eye that causes the eyeball tissue behind the eye to swell and push the eye forward. It can stretch the nerves and blood vessels supplying the eye and cause blindness. It's extraordinarily rare, but you should be aware of it. Other possible causes of visual loss include optic nerve damage, needle penetration of the eye. In my practice, I will not operate on an eye that doesn't have a plastic eye shield on it, and pain I think that's it. So I'll do that again. Other possible causes of visual loss of the eye include optic nerve damage or needle penetration of the eye during the surgery or advanced eye infection. I've never seen any of this. In my practice, I won't operate on an eye that doesn't have a plastic eye shield to protect the eye from the needle that we use in surgery. These things are extraordinarily rare, but I think again you should be aware of at least the possibility.